Hello and welcome to this week's What Were They Thinking? The first story is both a case study and cautionary tale. The Center for Disease Control and Prevention has recently issued their annual warning about ticks. These are 8-legged blood-sucking parasites that will often attach themselves to unsuspecting individuals. Places like the ears, belly button, armpits, and similar are free game. Less commonly infected places are the eyeball, such as in this case study. One unlucky individual found himself in the field working one day on power lines. His eyes became irritated. He let the workplace safety officer know and they attempted to wash it out. When that failed, he decided to take a few days, hoping the irritation would go away. When that didn't work, he went to an optometrist, who was immediately able to identify what was causing so many issues for him. It turns out, after it was removed, to be a tick in his eyeball. Fortunately, it could be removed without any significant complications, and the poor patient was sent home with antibiotics and steroids. Tick infestations of any sort can be deterred and minimized by the simple use of bug repellent. They can also harbor other unpleasant diseases such as Lyme disease. Unfortunately for this patient, he experienced one of the more unusual exposure routes, and as a result, he will be healing for a little while, but otherwise largely unharmed physically, but possibly psychologically traumatized. In other health-related news, there's been further development of the implantable detection technology, usually in the format of tattoos. In this case, researchers at the Technical University of Munich have been able to accurately estimate concentrations of different chemicals in the body based on the changing color of a tattoo and a smartphone app. The researchers have developed a series of dyes that respond to things like glucose, albumin, or pH changes. These are important in diseases like diabetes, where the ability to monitor the condition in real time would be of incredible importance to those who are suffering it and attempting to manage it. As with most recent attempts to make this technological leap, the dyes used are largely irreversible, which means they are no better than disposable test strips. In this case, 2 of the 3 dyes developed will change color once. In this case, the glucose dye goes from a pale greenish color to a dark greenish blue color. The albumin dye goes from a whitish pale blue color through to a bright pale blue color. And the pH dye, which is the reversible candidate, goes from a yellow coloration through green and then becomes a dark blue color. The methodologies have been tested on pigskin so far, and although not used in humans, unless and until the dye is entirely reversible and can be used repeatedly, the technology is not yet mature enough for application in a medical role. Once that happens, monitoring and application of medication could be infinitely easier for both patients and medical professionals. Speaking of medication, one study has recently described the use of aspirin as being both excessive and in use for the wrong reasons in many cases. The American College of Cardiology has stated that a large portion of the population that is over 70 and with heart disease, or younger than that and with heart disease, has been taking aspirin for the wrong reasons. Since the turn of the 20th century, aspirin has gained usage in the larger part of the population due to a series of misinformation programs and a misunderstanding of its application. It acts as a blood thinner, which prevents clots from forming, an important element for those with cardiovascular disease. It will prevent things like heart attack and stroke. However, it is not applicable to all cases of cardiovascular disease. as it thins blood, it may cause greater hemorrhaging if a laceration occurs. For this reason, it should only be used in particular cases. The co-authored guidelines from the American College of Cardiology and the American Heart Association have stated that exact position, that only certain diseases should be treated with aspirin. They came to this conclusion by taking data from the National Health Interview Survey and analyzed a sample of this with 14,000 adults over 40. They then scaled this to the entire US population. They found that approximately 29 million people were taking a daily aspirin dose, but none of these people had a heart disease. This means that they did not have the involvement of a doctor when choosing to take a medication that, if they were injured, could have adverse effects. When you combine these two groups of people, patients who are taking an inappropriate course of treatment, possibly without the involvement of their doctor, and then a large population of people taking this medication for reasons that are entirely unrelated to their health, you wind up with a possible series of severe complications. The next piece of health-related news is about the drug-resistant fungi that has been increasingly concerning the medical community. Over the last few years, a highly contagious and very drug-resistant form of yeast called Candida auris has been identified across the globe. It has been reported in more than 30 countries, and importantly, it has been identified in isolation in communities that shouldn't have been exposed to any transmittable version of it from somewhere else. This means that over 3 continents there have been 3 different strains of this fungi that have grown and developed these same resistances. Researchers believe they may have found some explanation as to why it has developed this, and it shares an interesting relationship with global warming. As you may know if you are familiar with this channel, yeast operates within a certain temperature range with greater effectiveness than others. For example, a lager yeast will grow and multiply at a lower temperature than an ale yeast. This Candida auris is interesting in that it is able to grow, multiply, and perform in a pathogenic function around 37 degrees centigrade, or the human body temperature, something that would otherwise be impossible for many other strains of yeast. The human body's response to pathogens is complex, but when you account for the more fundamental things, such as the skin acting as a barrier, the pH of the body, and the fact that we work at a temperature that is often not congruent with the proliferation of pathogens, the body works very well at limiting its growth. The fact that this fungus has been able to develop a natural, or at least adaptive, method to deal with higher temperatures was unusual. What the researchers believe, having taken samples from both the wild and having developed their own in-house strains, is that the rising global temperature has meant that species like bacteria and fungi have had to adapt to a higher global temperature. That higher global temperature brings them closer and closer to being able to cope with the human body's normal operating physiological temperature. This removes one of the more immediate barriers to infection and pathogenic action. The researchers state that it is unlikely to be the sole driving factor in the adaptation of the Candida auris strains and their pathogenicity and resistance to antifungals, but it is a contributing factor, and one that could be very interesting if other species follow suit. In similar and related genetics news, Chinese researchers have been able to remove mosquitoes from 2 islands using genetic modifications. Mosquitoes are a significant vector for many diseases, some of them being very dangerous, like Zika and dengue. These affect millions of people across the globe. Mosquitoes are also a very difficult vector to control. Netting, bug repellent, and a few other things help, but they do not prevent both the proliferation of a population and a reservoir sitting in the wild, waiting for the day that people say, okay, it's not an issue anymore. The researchers used a two-sided attack. The first included a dose of radiation which would sterilize mosquitoes. Then they added a bacterial strain called Wolbachia genus. This prevents mosquito eggs from hatching. Together, these were applied to the lab-grown mosquitoes. Because they were sterilized and the females of the mosquito population only breed once with any male they find, they were able to drastically reduce the number that were passing on viable eggs. Those that were passing on viable eggs were also likely to be contaminated with this bacteria. This then led to a significantly reduced population, about 94 to 96%. Because this creates a cascading effect, the first year they saw a drastic drop in the population, the second year slightly less drastic, but the number of mosquitoes caught each year was decreasing with periods of up to 6 weeks without any mosquitoes detected whatsoever. The researchers admit that the mosquitoes they did find may not have been native to the islands in question and instead migrated from the nearby mainland. However, if the program were expanded and extended, they might be able to get a more effective reduction and possibly permanent reduction in the population. In other space-related news, SpaceX has just passed its first test with the Mars prototype lander. Last week's What Were They Thinking reported the unsuccessful deployment of the prototype, wherein it caught fire. This week, SpaceX has announced a successful deployment of the same prototype. Unfortunately, a byproduct of that successful deployment was a fire in the area. The deployment started a brush fire that appears to have spread and then become contained by the local fire department. While SpaceX is working hard to get their Starhopper ready for deployment and testing new technology for ferrying people and equipment to Mars, India has just successfully launched their lunar lander. The Chandrayaan-2 was launched successfully and is India's second lunar mission. India is now in the contest to become the 4th country in the world to have successfully landed on the moon. They are also running against Israel, who recently had an unsuccessful landing of their Bereshit lunar lander. India has been able to achieve this with a very small budget compared to organizations like NASA, because much of the technology they use has been developed within their own country and particularly within their own organization. This ensures they can keep their costs low. India's space program has an approximate annual budget of $1.8 billion. This starkly compares to NASA's $21.5 billion. Speaking of technology, the next piece of news regards desalination plants. Finding a cheap and practical way to remove salt from ocean water would drastically reduce the issues of both landlocked water supplies and the limited amount of water available to most of the world. Current technology used for desalination plants relies heavily on things like reverse osmosis. This allows water to be separated from salt. However, it is very expensive, very large, and requires a lot of maintenance. Finding a way around this would allow countries that are otherwise unable to afford such technology, and those that can afford that sort of technology, to operate at a far reduced cost. This would allow access to water to all the population for a much lower price point. This new technology uses a small disc of super hydrophilic filter paper. This is layered with a carbon nanotube that absorbs light. This structure allows it to run on nothing but solar power. The fundamental idea in that respect is not new. What is important is that it removes almost all the salt in the original water that goes in there. The problem with this technology in the past has been that as the system works, the water will flow through freely for a time until the salt begins to clog the filter up. This new technology uses a different approach, with a cotton thread that transports the salty water to the evaporation disc. The pure water is trapped here, and the salts continue to be pushed out of the system. More importantly than that is that it is a small system. Very, very small, in fact. You can produce between 6 to 8 liters of clean, potable water with just a square meter of surface area each day. Given its relatively small size and efficacy, it could be used to provide potable water in isolated and regional areas. More importantly than that, the researchers believe they can increase the efficiency of the system. In technology news that is not productive, Facebook privacy flaws may be letting children talk to strangers online, even when the system is designed to prevent exactly that. Facebook provides a service called Messenger Kids. This is supposed to allow parental controls over who children engage with online. A recent report has found that key underlying premise has been broken due to a flaw in the app. This is not the only time Facebook has failed to provide appropriate controls within their service, but in this case, it is something that affects an especially vulnerable and innocent population. The flaw fundamentally works by allowing children to communicate with strangers in a group chat. This can then be moved into a private chat. The system and flaw works by allowing a child to use it, and in the group chat, another child's parents may have approved a complete stranger to talk with their children in the same group chat. The child who has not received that approval can quite easily communicate with this complete stranger. This allows someone who is completely unrelated to the child to give approval for that child to speak with unknown individuals. In other social-related news, the FaceApp that has taken the world by storm may be doing even more nefarious things than first thought. It's not just possibly stealing your data, it could be more that they can do if you read through the fine print of the agreement. The first point of concern, other than spending your life on an app, is that the Russian parent company to the app, Wireless Labs, is given a lifelong license to use the images you generate in it so long as you've agreed to the terms of service. This means both the original photo going into it and the photos generated through the various filters can be used however they see fit. As with other companies, you need to be aware of the next limitation, and that is, when you agree to the terms of service, there's a specific clause in there that says you are bound to go to arbitration if you want to make any claim for damages arising from using the app. Now, that's not unusual, and most people don't even look at the terms of service to realize this. Fortunately, because of where they've set this up in California, they're required to give you the opportunity to opt out of this arbitration clause, but that can only be done by sending written notifications to the company. That causes a problem in and of itself, but then you add in the next one, which says the company can change the terms of service at any time, but does not necessarily have to tell you they've done this, only that they should try to, meaning that even if you attempt to notify them of your intention to opt out of this clause, by the time they receive notification of that fact, depending upon which country you are living in, it may have been after they've updated their terms, which may mitigate your attempt to remove yourself. That's a slightly less concerning one than if the app was to suddenly bring in more stringent terms of service, such as you must pay for a license to be able to access your photos they've stored, or that they can modify and distribute your images whenever they see fit, and more terms that you won't know about unless they tell you, and they don't have to tell you. As scary as that is, there are ways around it, and perhaps the most obvious is to read the terms of service. Other than that, you can uninstall the app, and depending upon where you are located, you may be able to seek legal recourse to have them remove your data from their database. But it is always best practice to read those tedious long agreements before accepting them, as so very few people do. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.